There's basically 3 tests. There's a PCR, a fluorescent immunoassay, and then there's antigen testing. Most insurances are going to cover the COVID testing. The government has asked that they forego deductibles and co-pays in order to get everyone tested. If you want to get tested, obviously come to Quality Care ER and we can do all the testing that you need. But you can go to urgent cares, doctor's offices, and emergency departments to get tested for COVID. When you get a nasal swab, it is a little bit uncomfortable and occasionally we get some bleeding. But in general, doing the swab is very easy and not dangerous. The main difference between strep and flu and COVID is that there are actual treatments for strep and there are treatments for the flu. And currently we don't have a really good treatment for COVID. It is possible to have COVID without any symptoms, it's just less likely. The most common symptoms are fevers, chills, cough, congestion, runny nose, loss of taste, loss of smell. Some of the more severe symptoms are shortness of breath, chest pain, or passing out. And these are the reasons that you would obviously need to go to an emergency department. If you're sick with COVID, it is very, very important for you to quarantine so that you don't give it to other people. Limit access to your household. If people do come in there, then use the same precautions that you do anywhere else. Social distancing, washing your hands, and not touching your face. If you're eating in a restaurant, you need to use the same precautions that you would anywhere else. There is a small possibility that you could contract COVID from your server, but it's very unlikely that you would get it from your food from the cook.